I'm Dr. Ashwani Mehta and I work at Sir Gangaram Hospital, New Delhi. So we all know that heart failure with preserved ejection fraction is now being increasingly recognized as a very important heart failure element. And in this, obesity phenotype, which is very important and very significant, is close to about 80% of all the HFpEF patients. So which is huge. And if we need to treat these HFpEF patients, we need to think innovatively and look at the various strategies which we have for treating such patients. Obesity phenotype of HFpEF is an emerging problem, especially in the metropolitan cities of our country. Why? Because we are having a rapid rise of obesity. There is a sort of an epidemic of obesity in our country. And most of these patients, if not treated well, have so many other comorbidities also, have a very dismal prognosis. They often die of various cardiovascular diseases, renal failure, strokes, and also many other complications. So if we need to treat them, we need to treat them in an innovative way, and we also need to focus on drugs which help us reduce the body weight and especially target the central obesity. And among these drugs, I think there are 2-3 very important drugs which stand out. First one is the SGLT2 inhibitor, the only drug which has been approved for treatment for HFpEF class 1 indication. And then now after these huge success of STEP-HF and the GLP-1 RAs in this particular phenotype, after publishing of the SELECT data also, we know these drugs can change the outcomes of these patients. The idea is to treat them early, at a much younger age, and much earlier in the trajectory so that the outcomes improve. And here, the emerging drugs like the GLP, RAs and GIP analogs can really help in the form of tirzepatide and others. I think if we treat them early, focus on obesity, and also use appropriate strategies, we can really help them reduce the morbidity, mortality, and maybe in certain patients also reduce the mortality.